addition to today's clinical insight, we're going to have a travel vlog. We're going to California. But first, I want to start talking to you about the topic we're going to be talking about today, and that is OCT. But not OCT in the way that you normally think about OCT. OCT for the anterior segment and for scleral lens fitting. Now, most of us think about how glaucoma and macular degeneration and diabetic care and many other things for the posterior segment are managed and taken care of with our OCT. But the primary use that I use my OCT for is the anterior segment. And initially I got my start with that with regards to scleral contact lens fitting. And we've come a long ways with scleral contact lens fitting over the last 12 years since I started fitting them. And my OCT has been a major part of that. And the reason why is because I'm able to evaluate the depth of the lens better using my OCT than I am using an estimation method that we use in the slit lamp. See, there's basically three things that we want to be looking for with regards to OCT and scleral lenses. Number one is we want to be looking at the edge of the lens. The edge of the lens is quite possibly the most complicated area to fit with when it comes to scleral lenses. And when we're fitting that area of the lens, we want to ensure that the scleral lens is fitting as tangentially as possible onto the surface of the conjunctiva and the sclera. We don't want it digging in. We would call that impingement. We don't want it lifting off too much. We would call that compression. And either way will result in some blood vessel blanching. That's best seen when we can use a slit lamp, although we're learning how we can use our OCT to evaluate scleral lenses in that way. The second way that we want to look at the surface of a contact lens with our OCT is at the limbus to see if there is touch the limbus. The limbus is where stem cells of the cornea are made, so we don't want any contact lens rubbing in that particular area. And the third way we use our OCT to evaluate scleral lenses is the central clearance. We use our OCT for this because it's the most accurate way to get a number, because we can either use a vault map or we can use our calipers to measure it. It's much more consistent than using a slit lamp estimation method. And when we're using our OCT for this, we're able to get a good marker for the total depth. We want that depth to be between about 100 to 200 microns, ideally, after the lens is all settled out. And we can use our OCT to do that because we know that when we're fitting a lens, that lens will settle onto the eye by about 100 microns. So an ideally image would look like this. Here's an image that has way too much sagittal depth, and this particular image doesn't have enough. Beyond just these standard ways that you can utilize your OCT for evaluating the clearance, there's also some newer technologies that allow us to look at things a little bit more intricately, something called vault mapping. And this is some new software that's available on the OptiView, and we may be seeing it on some other OCTs in the future, but essentially what they do is they take the sagittal depth of the lens, the sagittal depth of the cornea, and they subtract the overall system to give you a range of how much clearance there is in the lens. It takes out the step of having to use the calipers, and it measures it all in I believe it's 8 different quadrants, which really saves a lot of time from having to look at things, because it may be fine in one quadrant, but in the other quadrant, it may be questionable. It also helps you understand if the lens is sagging or if it's starting to thin towards the periphery. So that's one of the technologies that I didn't mention on the other video that is really innovative and is kind of moving the scleral contact lens movement forward within regards to OCT. So as you can see, there's so many ways that we can use our OCT to evaluate for scleral lenses. We want to find that central clearance, we want to find the clearance at the limbus, and we want to see how that lens is either digging in or lifting off or sitting tangentially on the surface of the conjunctiva and sclera. But beyond just scleral contact lenses, we can use our OCT for so many other anterior segment things. We'll talk about this more in some future clinical insights, but for example, we can use our OCT to evaluate the meibomian glands. We can use it to look at tear meniscus height. We can use it to look at corneal pachymetry. We potentially can be picking up on some things with regards to how biometry measurements are taken to calculate IOLs. Maybe we'll be able to use it in the future to look at the density of cataracts. Maybe we'll be able to use it in the future to look at the thickness of epithelium. So all these sort of things some of these sort of things are even in research right now, and it'll be exciting to see if they pass through FDA. Some of them are available in other countries. So it'll be exciting to see how we can use our OCT potentially as a full-fledged anterior segment analysis of not only just the cornea and the angle, but we'll be able to evaluate it much more closely with regards to contact lens fitting, dry eye, maybe for evaluation of early disease. It's going to be great. I hope you're using your OCT at the level that you should, and if not, I'd encourage you to look into it.